Hey folks, John Adamson, the Rehab and Documentation Guru. So, making a video, this is a response video to one that the APTA just posted the other day. And the video was a forum of four individuals, one an APTA representative, a clinical person from the APTA, and then three panelists. And the title of this APTA video, which you can find on YouTube, is called The Impact of COVID-19 on the Mental Health of the Patient and the Clinician. Now, first, I want to say this. I give kudos to any organization that's trying to help during this particular time or any time, providing free information to the general public and to us clinicians. Free information that's helpful is always valuable. So, with that in mind, I also want to say that it's obvious that the people on the panel knew their stuff, had a lot of good information in their heads. They did provide some of that information during this panel discussion, but I wanted to talk a little bit about my criticisms of it. And with hindsight being 2020, it's easy for me as a viewer of it with more time to think about how the discussion went and criticize it than it was for them as panelists to talk off the cuff for questions that they were given, probably weren't initially given those answers, or those questions, prior to getting on this call. So they weren't able to prepare beforehand what they'd probably like to ultimately say. So I'm sure there could have been a lot more useful information in this. Now, this was a 1-hour video. And apparently this was a live discussion because they mentioned about people logging on and asking questions. So one of the concerns I have was that this was an incredibly, apparently, poorly attended webinar. There was a mention of maybe one or two attendees, and there was comments that were made by the moderator about comments posted at the time of this panel. So it's pretty clear not many people were on it. And as of right now, of course, this video was just posted the other day. There's only about 48 views as I just looked at it. So will this panel discussion ultimately reach as much of the intended audience that really needs to hear it? And the answer is maybe not. Now, if you do decide to watch it, which I watched it for you, but I would encourage you to check it out. I'm all about primary source material, listening to the person for themselves. That's why I don't like to listen to the news and what they say about the political figure, because they're likely to skew it. I like to hear it from the politician's mouth themselves. With that said, let me tell you that almost the whole first half of this panel discussion was just basically introduction and background of these panelists. So if you skip to about minute 27, roughly, into the discussion, you'll start getting into a little bit of meat. Now, I say a little bit of meat because there was not a lot of really good sound. These are the steps that you take to negate the negative impact of COVID-19 on the mental health of the patient and the clinician. There were some tidbits that I found to be intuitive, meaning things that I would have gleaned without having watched it, just based on clinical experience. There was some interesting information that I found helpful. About minute 28, one of the panelists, who herself is a PhD at Johns Hopkins, talked about it in an important website. If you're going to talk about impact of mental health, and so we're talking about not only cognitive but also psychological, you have to be able to measure that impact. And so she talks about standardized assessments or instruments. And this is a website that was given: www.improvelto.com/instruments. And there are a number of standardized tests that are available to you on there. And this is looking at different tests that are going to help you analyze where your patient is from a mental health perspective, whether it's cognitive or psychological. Now, the big thing they obviously talked about is all of us as rehab clinicians being more open to areas of concern that we did not necessarily get very strong focus of in school, and that would be cognitive and mental health. Now, obviously, you speech therapists, you focus a lot on that, and OTs, you get background in behavioral health, in psychological, that PT does not. But with that said, one of the things I took exception to that they said during this conversation was that 10 to 20 years ago, this kind of conversation about the mental health of the patient and the clinician was not really going on and not really thought of. And I might be slightly misstating their position, but this is what I got out of what they were saying. And so maybe they didn't quite mean this. And I would say that I reject that premise. 10 to 20 years ago, we had a lot more time with our patients. We didn't have nearly the productivity standards that we do now. And so we had an opportunity to get to know our patients more intimately. And all of us in the healthcare field, for the most part, I believe, are very sensitive to a patient's cognitive and psychological well-being. So I think we were already incorporating that as clinicians, even if on the national stage it was not so much discussed. The problem with our current healthcare state is that we've gotten to a point where productivity is pushed, where we just don't have time to focus on those cognitive and psychological parameters like we did in the past. So it's not that we're not sensitive to it, it's just that we're pushed to the point where we've got to be so productive that we can't think of these things. Now, those of us in home health are a little bit less under the gun, I think, in general. Some of you are in home health agencies are still really pushing you productivity to the point where you don't have time to go into this psychosocial stuff. But a lot of us can in home health, and that's the benefit of one-on-one care. So with that said, I reject the premise that we couldn't have had this discussion 10 to 20 years ago. I think we were better at it 10 to 20 years ago. What I did not get from this particular discussion, which really the meat was about the last 32, 33 minutes of it, was really getting into how do we impact mental health for our patients and clinicians. Now, there was a lot of focus on the patient. So some of the stressors, mainly around isolation. Isolation is a huge problem right now. We know that. We're seeing that. I just left a patient with a chronic progressive neurological disease. She's living with her parents. She is socially isolated because her parents don't want anybody in the home, and she was formerly very social, had friends, has a boyfriend coming over, spending time with her, and now her parents have shut that off. And that is causing her to have social isolation. And she told me the other day, "You're my only friend that's coming in." And that was very, heartwarming to hear from my perspective, because I realize I am somebody making a difference psychosocially with her right now. But too heartbreaking, because I know she's isolated and she needs that human interaction. So there was a lot of talk about that particular thing. Obviously, we're seeing in hospitals, loved ones going into ICUs, not being able to have loved ones come to visit them because of COVID-19 fears. Social distancing, this is causing a lot of social isolation. There was a little bit of discussion about the mental health of the clinician. And one of the things I couldn't help but think while they were talking about clinicians dealing with the stressors related to treating patients with COVID-19 or any serious long-term illness, is we're used to it. I don't think we're feeling a lot of stress related to COVID-19. When I see postings on like Facebook and whatnot about clinicians facing COVID-19 right now, some of it is about, they don't want to see patients right now because of concerns. But the main concern I'm seeing is dwindling caseloads. That's the main thing I'm seeing right now. And the main pressure that therapists are facing is financial. It really, we're used to seeing patients with, highly contagious diseases. We're used to seeing patients with very debilitating diseases. COVID-19 is just another means that patients have to having massive debilitating events in their lives. We're used to it. Nothing's changed for a therapist in that regard, I don't think. Some of you maybe have been impacted more by that, but we've seen it before. Been there, done that. Not a concern. What I would like to see the APTA and other organizations focus on is more of the impact that has been created by the loss of jobs. We had PD-PM hit. Then we had PD-GM hit. And then we're going to be facing Med-B cuts. And so we've got all of these things that have created overabundance of therapists for more limited job opportunities. We've seen therapists take tremendous cuts in pay. We've seen jobs being eliminated. I've seen therapists post that they can't find a job in their field and they've had to take jobs in a much lower paying job. And they're dealing with tremendous debt. We've seen the APTA through CAPTA, CAPTE, the accreditation organization for education for therapy programs. We've seen them create avenues for schools to charge more and more for the same education that allows them to see patients and get licensed, and creating huge debt loads on these therapists, now entering a field where they had been promised a growing and healthy, robust healthcare job market, to now facing limited job prospects with low pay and sometimes inability to actually meet the payments on those tremendous loans created by advancing the degree requirements so that schools can charge more and that we go into debt and we remain in debt much longer. Rather than looking at meaningful alternatives to get the same level of education in less years with less money. And I think that's something that the APTA, AOTA, and ASHA might want to be looking at, because when it comes to the mental health of the clinician, I don't think this panel discussion really touched on the true issue at all. Anyway, that's just my points. You may disagree with them. That's okay. I do encourage you to watch the impact of COVID-19 on the mental health of the patient and clinician, put out by the APTA yesterday and available free to watch on YouTube. And you can make your own determination of that. And I would love to see your comments and suggestions. Anyway, I've gone on too long. I wanted to make this more brief. I'm looking just for solid answers, solid pathways to addressing the concerns, primarily with the patient. Because you know what? I'm fine in this area. There's other concerns that I have, and it's partly for you. Anyway, John Adamson, the Rehab and Documentation Guru. Take care, and God bless.